true number of coronavirus cases. One America's Pearson Sharp has more as hospitals admit their data is flawed.
With the mainstream media sensationalizing coronavirus cases across the U.S., other reports are pouring in that hospitals are intentionally inflating their numbers of COVID-19 patients. An investigation of hospitals in Florida reveals health authorities were misreporting the number of positive patients all over the state. Hospitals were reporting a 100% positivity rate in infections, and numerous labs claimed every single patient that came in was testing positive for coronavirus. On Friday alone, 98 different labs reported 100% positivity rates, and experts say that's very concerning and means the results are likely inaccurate and cannot be trusted. One testing site, Censored, reported 83 people were tested, and all 83 were positive for coronavirus, something health officials say is extremely unlikely. Yet when investigators contacted hospitals like Orlando Health, which was reporting a 98% positivity rate, the hospital admitted there were errors in their report. The actual positivity rate wasn't 98% as they had claimed, but just 9%. And at the Orlando Veterans Medical Center, 76% of patients were testing positive. But it turns out that was an error as well, and in reality, just 6% were positive. Most absurdly, last week, even a man killed in a motorcycle accident in Florida's Orange County was reported as dying from coronavirus. When questioned about it, health officials wouldn't reveal whether or not the man's death was removed from the overall coronavirus death count in the state. According to the Florida Department of Health, although labs are required to report negative results, many haven't been, and these are now being investigated. But Florida's not alone, and similar cases are popping up in other states as well. In Connecticut, a state lab found that 90 patients who tested positive for coronavirus last week actually didn't have the virus. The State Department of Health revealed there was a flaw in the testing leading to false positives. This is especially concerning since the testing method is from a widely used process the state adopted in June, meaning there are likely many other cases of virus-free patients testing positive. And in Rhode Island, another 113 patients without any coronavirus at all tested positive at a private lab based in New York. Health officials say the patients received false positive results and the testing method is being investigated. Based on these examples alone, it's clear that testing facilities and hospitals are likely significantly inflating coronavirus cases. That means despite the dramatic reports from the mainstream media, the true number of cases is likely much lower than what's being reported.
All over the country that testing centers are over-reporting the true number of coronavirus cases. One America's Pearson Sharp has more as hospitals admit their data is flawed.